doctor.
Dr. Paul le Roux is one of a handful of reproductive specialists in the country and considered a bit of a miracle worker by his patients. Using a rare and technically difficult procedure, he's helped a cancer survivor conceive, which is a first for Africa.
There are many couples that have infertility, about 1 in 8 couples. About 1/3 of cases are related to problems in men, and another third of cases related to women, and another third are mixed, where there's a problem in both partners. In women, one of the problems can be decreased egg quality. As people get older, the quality of the eggs can decrease, and in some patients who have cancer and need chemotherapy treatment, the actual medication can damage the structure of the eggs, and the woman can go into early menopause and become infertile. In Leanne's case, she had a condition called Hodgkin's lymphoma, which is a cancer where chemotherapy medication has to be given. And normally this will damage the ovarian tissue so that the patient can't have a child in future. In these cases, there are options to try and preserve fertility. One option is to extract egg cells and freeze them, but this involves IVF treatment, which is expensive and not available to everybody. Another option, which is more rare, is ovarian tissue freezing. This is where we do an operation and remove an ovary and cut the ovary into tiny strips that are frozen and then later reimplanted into the patient to restore her fertility. The problem with this technique is it's very difficult. There's lots of complex technology involved in order to get it right. And for this reason, even though many doctors have attempted it, there are very few success stories. Currently, there's only about 10 to 15 patients throughout the world who've managed to have a successful procedure. So it's very exciting that this procedure could be done in Africa, and we're very happy that this technology can be applied in Africa and not just developed countries.
After rigorous chemotherapy and a bone marrow transplant, Leanne Williams has been in remission for 3 years.
The way I felt when I was in remission, I was very, very happy. I was thankful to the Lord for healing me. I thanked my family, I thanked my husband. At the time, my boyfriend, we were not engaged yet at the time. I was just grateful for giving me a second chance to live. And I just carried on with my life, and we planned our wedding, and we were just looking at the way forward. When I found I was pregnant, I was very, very happy. When I went to go see Dr. le Roux, and he confirmed the blood test, because we found out with the urine test. And I was jumping and said, Ashton, we're gonna have a baby. It was early in the morning. I called my mother at like 6 o'clock in the morning. I said, Mom, you're gonna be a grandmother. And you know, we were just very, very grateful and very thankful.
I felt during this whole journey with Leanne, with the chemo and everything, it was very overwhelming. It was traumatic. It's like a shock. But when we found out that we were pregnant, it was just exciting and it was just amazing. And the fact that it's a boy is even better.
Dr. le Roux believes his success with Leanne is thanks to a combination of factors and technologies working together.
This is a modern IVF laboratory. In the IVF laboratory, we extract the eggs and we fertilize them to make embryos, and we culture them and then place them back into the patient to make them pregnant. It's also the place that we can freeze tissue. And in Leanne's case, we froze ovarian tissue. This is a liquid nitrogen container, and the tissue is kept in a small plastic vial and inserted into the nitrogen, where it's kept at minus 196 degrees Celsius. It can be kept like that for many years. Financial cost unfortunately affects fertility treatments. In South Africa, many of the fertility treatments are not funded by the government or medical aids, and patients have to pay out of their own pocket. This has limited many patients in having fertility treatment. Ovarian tissue freezing procedure that we did with Leanne can be done with just surgical operations and minimal IVF intervention. I think in future, more patients with cancer will access this type of treatment, and we will certainly be able to help many more patients in the future have children.
Studies show that fertility preservation contributes positively toward cancer recovery, as it gives patients a reason to live and hope for the future.
What we hope for the future is possibly growing our family after such a delicate procedure, and after our history, it's just inspiring.
My advice for other women that are going through what I went through, or maybe they have fertility problems, they shouldn't give up.
they should really do what they can and to be proactive in whatever methods that are available to them to be able to conceive.
This problem does not only affect women. Men also may have cancer and need to preserve their fertility for the future. However, in men it's a lot easier. So we encourage the cancer doctors or oncologists to refer us men and women who have cancer very early so that we can talk to them about these options and hopefully allow them a chance to have a child. I would like to encourage men and women who face the diagnosis of cancer to speak to a fertility doctor. There really is hope still for them, and many of the patients actually cope better with their cancer treatment knowing that they have their potential fertility for the future.
I want to live the best life.